Hi, everyone. I'm just waiting for a few more people to get here, but this is Rachel. I'm very excited to be able to start this class. All right, so I'm just waiting a little bit. And also, I'm very excited to share with you this childbirth class. What we'll be learning is a little bit about pregnancy. We're going to be learning about postpartum care, newborn care, a little bit diving into breastfeeding as well. So a little of everything. We will be using a PowerPoint as well. So really excited. So to start off for just like a little introduction, my name is Rachel and I am a lactation nurse. I also am a postpartum nurse. I've been a postpartum nurse for about 9 years now, so I'm very excited about that. I know that it can be very stressful being a new mom, but at the same time, very exciting. So I figured that these childbirth classes would be a wonderful way that we can be able to support each other, and I can learn you guys can learn also what I've learned through years of hospital experience and just kind of being on the field for quite some time. So this class is very helpful. It's going to go over a little of everything. And what I do love is that this is an interactive class. So feel free to ask questions, feel free to introduce yourself, feel free to also interact with the other moms that are in this class as well. I know that some people are getting off of work, so I'll give everybody a minute as well. So I will be sharing our PowerPoint. I'm just gonna bring it up now. So this is my 8 steps of prepared childbirth PowerPoint. What I did is I made the most important lessons into kind of bite-sized lessons, making it very easy for you guys to understand. And now that we have a few more people on board with us today, I already introduced myself, but I figured you all can introduce yourself as well. You can say your name, maybe where you're from, how many weeks you are, and also that way I can gear the class towards, whatever you guys need most. So yet again, my name is Rachel. I'm from Florida. I don't know if you guys are nearby or not, but this is my prepared childbirth class. It takes basically what I've learned from my years of postpartum and lactation experience and put it into kind of this bite-sized class for you guys. It's actually me and baby Nathan. Nathan's my second born. So I have a 5-year-old and I also have a 3-year-old. So they're definitely a handful. Love them. So with Mateo, it was a very difficult experience for me, both the childbirth part of it, pregnancy. The pregnancy was difficult. The childbirth seemed like I was in labor for 18 hours. I was pushing for quite some time as well. And when it came to the breastfeeding, I didn't feel as prepared also with the breastfeeding. I remember doing like a countdown when it was time to put him to the breast. I'm like, 1, 2, 3, and I remember it was so painful. I would end up getting blisters and cracks, and he wasn't eating well, and he was losing a lot of weight as well, and we had to end up supplementing, and it just was kind of very chaotic. So then with my second delivery, I decided to prepare myself a lot more. With Nathan, we were able to exclusively breastfeed. The childbirth experience was a lot better. Been 5 hours in labor, literally one push. I realized how to even push better. And it was a great difference. So hi, Gabby and Julian, 33 weeks from Fort Lauderdale. I'm so excited to get to know you guys. We're actually very close by, so that's exciting. We actually had somebody that was going to come to this class today, and then she ended up delivering. So she was like, oh, I signed up for the class today and I ended up having my baby already. I was like, oh, well, that's good. At least you had the baby. So understanding your body. I know a lot of moms who tend to take this class are first-time moms. Now, what to be expected, especially in the beginning of your pregnancy, morning sickness, frequent urination, of course. If there's anything in specific that you're dealing with, you can always write it in the chat and we can discuss how to overcome them. For me, I dealt with sciatica, especially with my second baby. I dealt with the sciatica a lot. I just felt like there was a lot of kind of pinched nerves as well. And I remember doing fundal checks on moms postpartum, and I would bend down and be like, oh my goodness, this hurts so bad, just from the sciatica. So what really helped me with that was massaging even like the feet, also having binders. Binders helped a lot. Even for socks, they helped also. They have compression stockings. Compression stockings actually helped to kind of relieve the pressure a little bit as well. Emotional symptoms, insomnia. You always feel like you can't sleep when you're pregnant. I remember distinctly laying down thinking to myself, man, I can't sleep. I can't sleep. And I was kind of cuddled up next to my husband, and I was behind my husband. My husband was in front of me. And I guess my baby was moving a little bit. And he was like, Rachel, I think you need to move because the baby's kicking me. Like he literally was kicking him from my tummy to his back. And I'm like, imagine if you were me, where the baby's kicking my ribs 24/7. So what helped me was getting comfortable with pillows, trying also to pee a little bit before bed, because what I found is that if you need to get up a lot at night, what helps sometimes is just like peeing a little bit before you go to sleep, trying to limit the water a little bit before you go to sleep as well. And then that can help. I dealt with a lot of nasal congestion. Also, if you deal with nasal congestion, try not to use the Afrin nasal sprays, but you can always use like the saline drops, and those are good as well. Now, complications during pregnancy. You're going to have preeclampsia. Does anybody know what preeclampsia is? It's high something. And then I always want to make sure that people know the signs and symptoms of preeclampsia. Signs and symptoms, preeclampsia. The thing with preeclampsia it is a high blood pressure. So with the increased demands on the body from fluid, plus the extra hormones that are in place, sometimes women who are pregnant, they might have preeclampsia and their blood pressure rises during pregnancy. If that happens, usually the thing with high blood pressure is that it's kind of this late kind of symptoms show up late in high blood pressure. So once your blood pressure rises high enough is when you start showing symptoms, basically. But the biggest thing with those are blurred vision. You might have dizziness. You might have seizures as well. One of the earlier signs of that is actually swelling of the extremities. So that's why sometimes if you might have a lot of extremities in your feet, they might end up checking you for preeclampsia, checking your blood pressure and doing something called PIH labs, which are pregnancy-induced hypertension labs, where we're just checking kidney function. We're making sure everything's okay. We also have gestational diabetes, which is a complication during pregnancy of high blood sugar. We also have preterm labor. A lot of the time, sometimes you might have Braxton Hicks, and it seems like it's true labor when it's only Braxton Hicks. Now, the difference between Braxton Hicks and true labor is that Braxton Hicks are more practice contractions. True labor are ones that actually cause cervical dilation. That's number one. And then number two also is that true labor usually is a lot more intense. It doesn't go away when you rest or drink water. And it also, regular true labor usually becomes more and more intense and comes closer together, and it's more regular in interval. So that's how you can tell if you're having preterm labor versus Braxton Hicks. Is preterm labor, it's regular in interval, it's a lot more intense. You're going to notice also that that it doesn't really go away with resting and just water. So those are all things to think about. Now, I had a lot of nausea with my first baby. So I always like to have a little case study where we use what we learned in our previous kind of section and answer questions that might come up either with you or someone else. So my question now for you guys, and we have a few people joining us today with the class, is I wanted to know how you would help pretty much if, let's say I say, oh, I have hyperemesis, I have nausea, what would you say to help the situation? And you guys can chat. You'll see there's a little live chat box. It's right next to the thumbs up, which you can always do the thumbs up while you're doing that as well. I'm like, hey, I'll do my thumbs up. There's thumbs down, which hopefully we don't have the thumbs down. And then there's a live chat box. The live chat box is really nice because you can be able to interact. And that's the point of this class as well, is that we can interact, we can talk, ask questions, and that's how truly you can learn as well. So how would you help somebody who had nausea? What are some recommendations that you would give them. So for me, I would say try to limit the fat and greasy foods. Yes, we had someone say ginger tea. Ginger tea is so helpful. So one kind of nursing secret that we do is that I'll take ginger ale. And sometimes we'll bring it in. They're like, wow, this is amazing. This is a secret recipe. This is the secret nursing recipe. We take ginger ale, we put it in the microwave for a minute, and then we put a tea bag inside. And there you go, ginger tea, and it tastes amazing. So one thing that I'll do for hyperemesis or moms who have nausea, sometimes we'll make ginger tea. And it sounds funny, but it works. And it even works during pregnancy. And it also works after delivery, where sometimes your C-section moms, sometimes they're a little nauseous after the epidural, after the spinal, sorry. So that works as well. Sometimes it even helps them pee. So that's a little nursing secret, compliments of Rachel. Now, I always go into preparation as well. It's really important to make sure that you're prepared for delivery, especially when you're getting closer to your delivery time. So, you're getting your 30 weeks, 32 weeks, 36 weeks, and you're like, oh my goodness, I'm getting there. So one is remember the power of your words. Your words have this amazing ability to affect how your body works. And it has this amazing ability to even affect how you're thinking. So remember the power of your words. And so many times I'll have a patient, let's say they come out from labor and delivery and they go to postpartum and they have their baby and they're just sitting there with their baby like this. And they're just like, oh, I don't know if I can do this, or, I'm not doing so great. And your words are really powerful. So remember the effect of your words. Have positive words, speak positivity into your life and that of your baby as well. Try to keep the negative thoughts, negative emotions to the side, and you want to have your positive support system as close as possible and make sure that they continue that positivity as well. Don't neglect what gives you joy. That's a huge thing that a lot of people forget as well, is that you neglect what gives you joy and happiness when you have a baby. Now, when you have a baby, your dynamics do change. I'll give you that. So for example, for me, I'm a piano player. I love to sing. I'm the worship leader in my church. And then for me, having my first baby changed a lot of the dynamics. And I actually ended up getting postpartum depression. It was short-lived, but the main reason was because of the dynamics that changed, where before I was leading worship, before I was always in practices, before I was involved in all of the music. Now I'm sitting in the back row with my baby and I don't want to make a, hassle if I have to leave. So I'm trying to sit in the, corner somewhere, and I wasn't involved as I used to be. And then I started to realize that I have to kind of change my dynamics where I can still participate in the stuff that gives me joy. It's just the dynamics change. So for example, I'm still in the music, but the music is not the only thing that I do at the same time. So those are just different things where you want to think about. If you're a member of a book club, keep the book club. If you're part of your church, keep that. If you are a part of an art group or something like that, you want to always try to don't neglect what gives you joy. And then keep your support system close as well. And that also goes into being honest with your support system. So sometimes your support system might be a little bit more negative than you really wanted. So just make sure to be open with them so that they really are aware of your wishes. So if they are a little bit negative, just be open with them, be honest with them, tell them what you really need from them in that moment. So we have our next case study, and hello, Anthonine and Ricardo. Sorry, I probably pronounced your name wrong. I'm sorry if I did. Delray Beach, 18 weeks. And that's such a beautiful time too. At least you're coming into that second trimester, kind of second wind, which is really necessary when you have a new baby, especially. So it is a pleasure to meet you. So my next question for you guys is, how will you give advice to a mom who's afraid of being a first-time mom? So we were talking about different ways of preparing for childbirth, mentally as well as physically. We were talking about different ways of changing your dynamics. What advice would you give to someone who's afraid of being a first-time mom? What would you tell them? And you're kind of speaking to yourself here. I'll give you guys a minute to gather your thoughts. For me, by the way, going from no children to one child was a lot more difficult than going from one child to two children. I'll also put that out there too. So sometimes you're nervous about being a mom, or you're nervous about being a new mom. You're like, oh my goodness, I don't know if I can do this. But keep in mind too, going from no children to one child is a lot different than going from one to two. So sometimes I'll have second time parents who are like, oh man, it was so difficult, our first delivery, our first baby. But there's still hope. Now, when it comes to overcoming fear of being a first-time mom, this advice is for everybody. Number one is don't sweat it. Chill out, relax. At least you are taking these classes. You're staying on top of your prenatal education. That is so important. Relax. You're not going to destroy your baby's life by holding them the wrong way, or by not looking at them the right way, or by listening to the wrong TV show right as they come out. So my first advice would be, relax, listen to your intuition when it comes to your child. And that is first and foremost. So especially, let's say when it comes to doctors and nurses, your baby more than anybody else. You have a right to treatment. You have a right to know the treatments as well. So sometimes even being on board with your medical team can be a huge benefit for parents as well. Now, labor and delivery is the section where everyone wants to know about. So I always go over pregnancy too, because it's really important to prepare appropriately. Now for childbirth, here are some signs of labor, and that's what everyone's looking forward to, except for Ricardo and Anthony. You don't want any signs of labor for quite some time, but to be expected, we have lightning. That is when the baby starts to engage in the pelvis, and you might feel kind of this intense kind of sharp, whoa, what just happened? It's going kind of like a zing. That is kind of the baby starting to engage, the baby dropping. You might even see the baby dropping. Next is a bloody show, which is also something you might see with a mucus plug. So if you're wondering kind of what the mucus plug is, where the cervix is, and the cervix ends up dilating, there's a little mucus plug that's in there. Now, as the cervix dilates, what ends up happening is that mucus plug starts to be released. So when you lose your mucus plug, especially when you are contracting, that is a pretty good sign that your contractions are causing cervical dilation, just because obviously the mucus plug was released. Now, as a nurse, it's not so important if you have your bloody show or your mucus plug. We don't really we're still going to do, a lot of the times we'll do the vaginal exam unless you're in a birthing center, or you prefer not to have vaginal exams for whatever reason. The biggest thing we're looking for is your water breaking. Now, your water breaking is not necessarily like the movies, where in the movies, it's like you're walking in the grocery store and your water breaks and you're like, oh, look, I'm in labor. Sometimes it is like that. But for the majority of the time, you're actually, you can still be in active labor without your water breaking. With both of my kids, I started active labor before my water broke. Now, if your water breaks before you're in active labor and before you're admitted, you want to note the time that your water broke. Now, that's really important, especially the time. You want to note the color of your water breaking, because it's supposed to be clear. It might even be a little bloody tinged, but if it is black or even has a little green, that can mean that the baby is in some form of distress. So those are all signs that you would definitely want to head to the OB right away, head to the hospital right away if your water breaks and it has any weird looking color. Another one is if it has a weird odor. So water breaking is usually odorless. It should not really have an odor. If it has an odor, that can be a sign of an infection. So if your water breaks, you want to look at the time, you want to look at the color, and you want to look at the odor. So if any of those seem off to you, you can head to the hospital, head to your birthing center, or let your OB know, your midwife, whatever is going on. Nesting is another sign of childbirth is coming. Now, I don't know about you, but for me, with both of my kids, it's like I felt like I was nesting my whole pregnancy. It was like as soon as I found out I was pregnant, I started nesting, and I'm like getting the nursery ready, and I'm getting everything ready. But then once your baby's actually starting to come, what you'll notice is that nesting starts to kind of go to another level. That's when I started, like, I don't know who else has age like age organized their nursery. I don't know if anybody else age organized their nursery, but I age organized my nursery. I like put different bins with different age groups. I'm like, all right, this is newborn, this is 0 to 3, this is 3 to 6. But I ended up doing that. I ended up even putting things in little baggies. And like everything has to be ready for the baby. And that's nesting. Side note for hospital bags, keep in mind that there are a lot of things that people pack in the hospital bag that in reality we actually give you. So for example, pads. We do give you pads, but if you want to bring your own pads, you can always bring your own, that's fine as well. It's just some people like it because it's free, but at the same time, some people like their own pads because sometimes they're more absorbent. You can also bring your own abdominal binder if you want, but a lot of the times we'll provide you with one. If we don't, you can always request it. We also give you the really sexy Victoria's Secret underwear that's like mesh panties. We do give you those. You can always, some people like to bring those Depend underwears. You can have them as well. You are, after delivery, going to have a little bit of bleeding, almost like a heavy period. So whatever you want to be comfortable. Usually when it comes to your hospital bag, I'll recommend that people bring whatever makes you comfortable. So if it's a blanket that makes you comfortable, a pillow, a robe, socks, whatever makes you comfortable. Another kind of pro nursing tip is that the streaming in most hospitals are not very good. However, I've noticed that Amazon Fire Sticks work really good for streaming. And I've noticed that it actually streams better and you can even connect it. Most hospital rooms will have a television with that you can actually connect it to. So what I've noticed is that usually it streams better on the Fire Stick than it does with like a laptop or an iPad, unless you're using like your phone with its own data plan. So that's another pro nursing tip. Regular contractions are also another sign of labor. So with labor, you'll notice that there's a difference between true labor and false labor. True labor is regular in consistency and frequency. It's also very intense. So what you'll notice is that it feels like your forehead in intensity, so that it's really, really hard. And that's how your belly is going to feel. Although sometimes I know some people's belly still feels pretty hard, but usually a contraction, it's like very, very hard. Your belly is going to be intense. You're not going to be able to talk through it. And you're going to notice that difference with that. You're also going to have ring of fire when the baby is actually coming out. Now, if you have an epidural, the biggest difference is that you still feel the pressure, but you won't really feel the pain. So you can keep that in mind as well. You might still feel the pressure. Complications of normal heart rate. So the biggest thing is that when you are pregnant, your placenta is giving the baby all the oxygen that they need. So what ends up happening is if all of a sudden during contraction, the blood flow to the placenta is, for whatever reason, what happens during contraction is the blood flow through the placenta is decreased. Now, if the baby doesn't have a good enough kind of buffer for that, that's when their heart rate starts to drop. So if you ever wonder, oh man, the heart rate's starting to drop, what is it? It's because of the oxygenation during contractions. So if that happens, they'll normally try to slow down or stop the Pitocin if you have it. They'll try to turn you on their side. They might even give you a face mask. Like I actually needed a face mask with my second baby. It wasn't because I was deoxygenated. It was because my baby's heart rate was dropping. So those are some things to think about. If you do notice that your baby has a low heart rate, they'll probably turn you to the side. They'll slow down the Pitocin. They'll try to maybe give you a face mask, and they'll also try to keep your pain under control, because if you can't breathe, you're not going to be offering as much oxygen to the baby. So we're going to talk about breathing methods and pain management techniques as well. Lacerations. So here's another pro nursing tip as well. Lacerations, they hurt less than episiotomies. However, episiotomies do hurt more. However, episiotomies tend to heal better than lacerations. So keep that in mind. Lacerations are normally repaired by the doctor after delivery, but it's, obviously a jagged tear, so it's going to take a little bit longer to recover. In episiotomy, the recovery time is quicker. However, it is more painful. So just be aware of that and be a good, I guess you could say, advocate for yourself. when delivery is coming, if you want it to be to have an episiotomy or not. The choice is yours. It really depends on a variety of different factors, but at least you know some of the pros and some of the cons. Complications, failure to progress, is when the baby is not, for some reason, either moving down or you're not dilating. Now, the biggest way to help with failure to progress is good pain management techniques and also to keep the bladder empty. So what a lot of people don't realize is that when the bladder is full, it causes pressure against the uterus, and it doesn't always allow you to really dilate. So that's why they also, if you have, let's say, an epidural, they might give you a catheter to keep your bladder empty, or they might say, go to the bathroom. It's the same thing also after you have the baby. If you have a lot of pain, cesarean pain, if you go to the bathroom often, let's say you have contractions, what will happen is that every time you empty your bladder, it will help with your contractions. So emptying your bladder is pretty much good in all aspects. Shoulder dystocia is when the baby's head comes out and then it kind of gets stuck. That's when they have to do some manipulation to get the baby out. Umbilical cord issues, let's say the umbilical cord's wrapped around the baby's neck, or if it's, let's say you're laying on your back like this, and then it clamps down on the umbilical cord. Now, keep in mind, let's say you're asleep, you wake up and you're on your back, don't freak out, just go to your side. A lot of the times your body would react. So let's say you're on your back like this, your body will start to react because it's going to be harder to breathe. And it's going to be also, your body's going to recognize that. So if you do realize that you're on your back, don't freak out. All you have to do is turn to your side. And then what you can do is you can always do kick counts if you want it. However, keep in mind that usually kick counts are most effective after you eat. So sometimes if you're laying down, they're not going to be as active, although sometimes they are, but kick counts are within a 2-hour time period. You would want to see about 10 movements, not including hiccups. Because hiccups, you'll notice that they're more regular. So we talked a little bit about the signs of labor. We talked about complications during labor. Now, who can tell me the difference between true and false labor? We're going to see how you guys have been paying attention. Now, yet again, you can, for those of you who are just joining as well, we do have the live chat, and feel free to introduce yourself and answer the questions, or even ask questions in the live chat. You literally have a postpartum, labor and delivery, baby nurse, NICU nurse, lactation consultant here at your disposal. So you might as well use it to your advantage and ask me any questions that you have. So to distinguish between true and false labor, the biggest difference is that true labor, remember, is regular in frequency. It also comes closer together. False labor is very irregular. It doesn't really go away when you when you rest, relax, and drink water. True labor will still start progressing. So keep that in mind. I would have a lot of Braxton Hicks, but that's because nurses are really bad at taking care of ourselves. So we take really good care of other people, but when it comes to ourselves, we're really bad at it. So with both of my pregnancies, I wouldn't end up drinking that much water, and I wouldn't stop. I would just keep on going. So then I would end up getting Braxton Hicks, just because I would, how nurses are. It's like, we can't stop if there's stuff to do. We have to keep on going. So labor and delivery, understanding exams and treatments. Now, I'm a huge advocate for my patients, and I expect you guys to be advocates for yourselves as well. You have rights as a patient, and you have rights as a mom. Now, what are your rights? You have a right to refuse treatments. You have a right to request what is going on. You have a right for education. I think the right for education is one that a lot of moms are kind of nervous to ask about, but you have a right to knowledge, or a right to education. You have a right to know what is being done, why is it being done, and what will happen if, for whatever reason, it comes out of range. So especially if you're having treatments, keep that in mind. You even have the ability to, if you're having tests done, what is this test for? Okay, what's normal? What's normal range? Okay, what happens if it's abnormal range? And keep that in mind. So Savina and Ariel, 27 weeks in Hollywood, Florida. Nice to meet you as well. And I love all my people with my great second trimester second win. So that's amazing. So it's so nice to meet everybody. And like I said before, if you have any questions, you can always let me know. You have a nurse at your disposal for the next hour or so. So use me if any questions come up, or you have any, or if you've had questions going to your doctor's office, by all means, I'm all ears. Now for tests, CBC, you'll hear us nurses say that a lot. That's basically your complete blood count. Now, for your complete blood count, we're going to look at your hemoglobin, your hematocrit levels. We're going to look at your blood type and screen. That's another one as well. The biggest thing with your CBC is we're looking at your hemoglobin, your iron level, your hematocrit level. We're going to make sure you're not anemic. If you are anemic, we might have to give you iron or possibly even blood, if it's okay with your religion, before you deliver. It is also good to have a baseline before you deliver, so that usually what happens is after delivery, I don't know who's doing a hospital and who's doing home, who's doing birthing center. If you guys don't mind, you can write it in the chat. That way I can kind of gear this class towards whatever birthing location you will have, just because wherever you will be delivering, usually the exams, treatments, and procedures are different. So I've worked in the hospital. However, I do know the protocols for birthing centers and home births as well. Now, if you do have a hospital birth, usually we'll want all of your prenatal records, and try to keep your prenatal records with you if you can, especially if you're more than 32, 36 weeks pregnant, because if we don't have these maternal tests, so all of these tests here, if we don't have the results, we might have to possibly check them again. And thank you so much. So hospital. So at least I know, like, all right, these are the protocols we have to focus on. So what ends up happening is if we don't have your prenatal records and you go to the hospital, a lot of the time they will have to redraw all of those. So depending on your insurance, that can be pretty costly. So this by itself can save you hundreds, if not thousands of dollars, depending on your insurance plan. Especially because, like, for example, the hepatitis B, if we don't have your results and we have to do it, and let's say we don't get those results before you deliver, what ends up happening is the baby might have to get a hepatitis B immunoglobulin, which is pretty expensive. So keep that in mind. So scheduled C-section maybe. So that's good to know, because then I can know we're focusing on hospital births, we're focusing on vaginal and cesarean deliveries. So, and it's coming up, like January will come very quickly. So especially for cesarean births, we're going to be looking into your complete blood count, your hematocrit, your hemoglobin, your iron levels. Is normal to drop about 3 points, up to 3 points with a C-section, and up to 2 points with a vaginal delivery. So let's say you come in with an iron level of 11, which is pretty normal and pretty good support. So that's good. We'll say, all right, great. Your hemoglobin's 11. Now, let's say you have a C-section and then you end up with a hemoglobin of 8. I'm like, all right, that's quite a bit. However, that's still within the normal range. Now, if you end up with 7, we're like, oh man, that's 4 points lower. That's when we might have to start with intervention. So that's why it's so important to understand these treatments, understanding the tests and what's going on. So CBC, looking for hemoglobin, hematocrit, white blood count as well. Your white blood cells are kind of like your soldiers. So if your soldiers are getting higher, we're like, all right, is there something brewing in there? Is it an infection? What's going on? Especially UTIs can be common during pregnancy. Rubella, if you're not immune, you cannot have your rubella vaccine during pregnancy, but if you are not immune, you can have it after delivery. And normally the booster shot is due every 10 years. Rubella is not necessarily for your baby right now, but if you were to have measles, mumps, or rubella while you're pregnant, the actual disease, it can cause a miscarriage. So that's why if you're not immune, they recommend to have the rubella vaccine after. Now we have HIV, Hep B, GBS. GBS is your group beta strep. So if you are group beta strep positive, the biggest things is that group beta strep is a naturally occurring bacteria that a lot of women have in their vaginal area. It's a part of their vaginal flora. If they end up positive, however, they need to have some extra treatments with antibiotics, especially if you are in the hospital. Now, one thing to think about, if you are even a C-section, let's say you're a C-section and you come in labor, and then they end up sectioning you, If you're GBS positive, because you were in labor, the baby will probably still need to have a sepsis workup, even though you had a C-section. So that's when they do extra tests to make sure the baby doesn't have an infection. So the biggest way to kind of prevent that is if you're GBS positive, make sure that you have enough time to go to the hospital, that you don't have to end up having extra tests for the baby. Because if you're GBS positive and you don't have enough treatment, then the baby can end up needing extra lab work. And I, for one, do not like doing extra labs on babies when it's not necessary. So that's why I always go over these tests. Vaginal exams as well. We're looking at how dilated you are. We're looking at how soft the cervix is. We're looking if the cervix is posterior or it's an anterior. Your cervix actually moves more anterior, closer to the vaginal opening as you progress through your delivery. Now, we were talking about GBS, if you're positive, and how to save the baby from unnecessary tests and treatments. So in the chat box, you guys can mention to just kind of review, how would you save your baby from unnecessary tests and treatments if you are GBS positive? We mentioned a pretty good way. And as a review, what you can do is there's right next to the thumbs up, there's a thumbs up, there's a thumbs down, and there's a live chat. You can always put it in the live chat, and you can always thumbs up while you're in there. You can always subscribe as well. I got so many different videos for labor and delivery. I'm not sure if anybody saw my other videos, but I have some really great content, some really great information. I even have like actual breast pumps. We go over how to use them. So it's a lot of great stuff. So GBS positive, if you are GBS positive, we mentioned it before, but make sure that you go to the hospital soon enough that you can be able to have at least 2 doses of antibiotics. That's what we're waiting for if you're GBS positive. Now, this is the section everybody wants to know about, and that is pain relief, especially during childbirth. So whether you have hospital birth, home birth, birthing center, I know most people said that they were having a hospital birth. So if you're having a home birth or birthing center, or have any questions about your birthing plan, you can always let me know. And you can always call me on the description for this. So it'll have the description for this video, has a whole bunch of resources. It has my number as well. So you can always call me if you want. My number is on the description. You can always email mommydidyouknow@gmail.com. You can also check on mommydidyouknow.com, and it has a lot of great resources for you. It has a blog, a lot of articles too. So for pain relief methods, now I always go over non-pharmacological, and keep in mind that you can do a combination. So you might be all into Lamaze, but my recommendation is don't only learn one method, learn a mixture of different methods, especially I'm thinking as a nurse. Nurses, we know a little bit about everything, and that works because we're looking at a person as a whole person. I'm not going into a room and saying, okay, that's the vaginal delivery, or that's the broken arm in room 10, but we look at the whole person. So for the whole person, what you're going to notice is that to be most effective with your pain management techniques, you want to learn a little bit about everything and combine them with whatever method works for you. So for example, Lamaze, some really easy breathing techniques. The basics with Lamaze is that it is guided meditation, guided breathing. A basic exercise that you can do is, number one, you pick a focal point. Let's say my focal point is the clock. Say focal point is daddy. Focal point is the spot on the wall that nobody decided to get off. But you pick the focal point. Then what you can do after picking the focal point is that you would take a breath in 3 counts through your nose, and then out through your mouth 3 counts. Now, what you can do is try to visualize a different section of your body, because the thing with Lamaze is it's most powerful if you combine the focused breathing with guided imagery as well. So that's the big thing with Lamaze. So let's say we have our focused breathing. We're focusing our breathing. We're breathing in 3, we're breathing out. 3, we have a focal point. Very simple technique you can do. Now, when it comes to the imagery, what you can do is you can visualize a different section of your body, visualize your arm, visualize your leg, visualize this abdomen. What you're doing is you're focusing on one part of the body, so you're not focusing on other parts of the body. Guided imagery. You focus on what your baby is going to look like. You focus on visualizing yourself giving birth. You visualize that first skin to skin time with your baby. You visualize that first breastfeeding session, maybe. So that is a good way of incorporating Lamaze into your pain relief routine. Now, acupuncture. Acupuncture is not like a scary person coming and putting needles all over you, although that is one type of acupuncture, but it can be a little different. I personally like the acupuncture where you have different pressure points and you can apply those pressure points to cause your contractions to move down and move forward and to progress your labor. So imagine this. Let's say you have your focused breathing, you have your guided imagery, and then you have your pressure points. Pressure points can be like here. And I don't know if you've ever had a headache before. You have a headache, you press in here. This is a pressure point that relieves pressure off of the head. It also helps to progress your labor. Let's say you have pressure point right here. This is another great pressure point where you can use to progress your labor downwards. Another great place where you can apply pressure is if you have back labor. Let's say you're having back labor, baby's coming, maybe in an awkward position, ending up with a lot of back labor. What you can do is actually lean forward and have somebody right on your sacrum push in. What that does is that helps to alleviate the pressure off of your sacrum and off of your back while you are having that back labor. So all of those acupuncture, basically the basics of acupuncture is that you are using what you know about the body to help to progress your labor quicker and to kind of take the pain away a little bit. But more than anything, acupuncture helps to progress labor. Lamaze helps to control your breathing and make pain more manageable. So that is how they blend together. Imagine if you're doing those focus exercises as someone is massaging your back or another pressure point. On mommydidyouknow.com, I also have information about my private prenatal packages, which basically is a class like this, but I'm focused with you one-on-one by Zoom. And then what we do is if you want to focus on acupuncture, we can focus on that. Lamaze, we can focus on that. And it also has a whole bunch of cheat sheets. If you go to mommydidyouknow.com, you look up the childbirth mastery toolkit. It has a whole bunch of acupuncture points. It has a whole PDF on Lamaze exercises. It even has hypnobirthing mantras and things like that. And all of that's on mommydidyouknow.com. You can also have consultations with me prenatally. All you have to do is email me or send me a message as well. And my number, by the way, is on the chat. I'm going to put it right now. And then you guys can always call me. I am local. If you are in South Florida, I live in Boynton Beach, but I go all the way down sometimes even to the Hollywood area, and I go all the way north. I've even gone all the way to Port St. Lucie, and I've gone all the way down to Hollandale. And what I do is I do virtual prenatal classes. And then once the baby is born, I also do home visits, and I'll make sure the baby's all right and latching well, and we'll do the first bath and, whatever else you have in mind. What's also really nice is that I do send everything to the pediatrician. So if you have concerns, we can always go over that. And I do virtual visits while you're in the hospital too. So if you wanted. So we have Lamaze, the focused breathing. We also have your guided imagery. We have your acupuncture, your pressure points to progress your labor quicker. We also have water birth is another non-pharmacological pain relief method. Birthing centers sometimes will allow for water births. However, hospitals usually do not. The biggest thing with water birth, it has two big things. One is that it allows you to move around a little bit better so that you can get the baby down a little bit more. And then two is it also kind of alleviates the pressure that you might feel. And it allows you to go and kind of goes hand in hand with the positions thing, because then it allows positions where you might be a little bit more comfortable to deliver. Now, meditations, hypnobirthing, that is also pretty much guided imagery. In addition to positive affirmations. So what I do is I'll normally, for my clients as well who are with me prenatally, we have flashcards. So that works really well, especially if, let's say you have flashcards. You can even have aromatherapy on your flashcards. And then you can have your breathing exercises, and you can focus on the mantra can be your focal point, or your flashcard can be your focal point as you visualize it in your head, your baby being born, and you have that positive affirmation. So as you can see, that's the power of these non-pharmacological pain relief methods. It's not in one individual method as much as the combination of them together. Now, pushing. Gentle delayed pushing. That means that you want to wait to push until you are ready to push. One of the biggest reasons why some people end up tearing is because they push before they are ready. So let's say they push before they're ready. Let's say they're 9, and they're like, all right, I'm ready. Or let's say they're 10, but the baby's not all the way down yet. They might end up pushing. So what you want to do is wait until the baby's down, wait until your cervix is anterior, wait until you're ready to push. Don't feel like you have to push just because you're at 10. You want to have different things in mind as well. If anyone has any questions about these pain relief methods or childbirth, you can write it in the chat. Especially this is one of the hot topics when it comes to childbirth is how do I control my pain as I'm delivering? So these are a whole bunch of different ways that we went over. Now for pharmacological pain relief methods, one is nitrous oxide, which is the laughing gas. They don't really use it that much. However, sometimes they might use it in birthing centers that do not use epidurals. So you can keep that in mind as well. It's just we don't really use it that often. Local anesthesia is if you are pushing. Sometimes they might give you a lidocaine locally just on the vaginal area, the perineal area as you are delivering the baby to kind of alleviate the pressure just for that ring of fire that happens as the baby's coming out. We also have IV pain medications. So some people are afraid of the epidural, so they choose IV pain medications. The biggest thing with IV pain medications is that they're short-lived and they might not take away the pain completely. The whole point of IV pain medications is that they take the edge off. So, and they also make you a little loopy. So keep that in mind also that IV pain medications, you might get a little loopy with it, kind of short-lived, and more than anything, it also just kind of takes the edge off, but that's it. Another thing is if you have IV pain medications too quick to delivery, too soon before you deliver, what can end up happening is that it can cause respiratory depression or even breathing issues for the baby. So if you do have IV pain medications, one thing to keep in mind is that you don't want to wait until you're right about to push, because if it's too quick, and let's say you have your IV pain medication, baby comes right out, we've had to give Narcan to babies because moms have had, let's say, Nubane or another medication, Demerol, before she had the baby, and then the baby ended up having respiratory problems before. If you have a little bit of time before, that's okay, but not too close before your delivery time. Epidural, that is a spinal block. They will usually do it when you're not progressed too far along because they need you to be still, but they don't want to give it when it's too soon either. They want to have just Goldilocks, basically. So usually when it comes to your epidural, they'll give you some fluid first. They'll give you a bolus of fluid because the biggest side effect of an epidural is low blood pressure. So what you'll notice is if you have the epidural and you have low blood pressure, they might have to give you some fluid before. When you have the epidural, you're pretty much going to go to the corner of the bed. They're going to lean you off to the kind of forward like this. And then you're going to want to open your back. And you can even practice doing that if you want and kind of feel how it feels with different positions. But you want to open your back as much as you can to allow them not to have to try too many times. Try not to move. And you can even use those focused breathing exercises and those Lamaze exercises that we talked about as you are getting the epidural. They're first going to put a drape over you that has a little circle. Then they're going to clean the circle, which is normally pretty cold. So keep that in mind. They then have the needle, which is a pretty big needle. So try not to look at it. Then they will insert the needle, take the needle out. The catheter with the plastic stays in. So the needle is out, catheter with plastic stays in. Then that catheter is going to stay in until you have the baby. And then during that time, they're going to be administering medications as necessary. So that's the basic of an epidural. While you have the epidural, you're usually going to have a Foley, which is a catheter that drains your urine, unless you have a walking epidural. So most of the hospitals in South Florida do not have walking epidurals. So I noticed for the ones that mentioned where they were from, Delray Beach, Hollywood, Fort Lauderdale, pretty much the hospitals that I've heard of around, they don't really have walking epidurals. So you're probably going to be on bed rest after that, and you're probably going to not be able to eat either. So keep that in mind that if you come in for induction, you might be able to eat maybe for like an hour period of time. Sometimes if we have to give, let's say we do an induction overnight and have to give Cervidil to soften the cervix, we might allow you to eat before we give you a second dose of Cervidil or before we have to put Pitocin. But other than that, we try not to have people eat, just because if you do have to go for a C-section or general, a spinal, something like that, it can cause some complications with it, and it can cause also a lot of nausea after. So that's the biggest thing with the epidural. Normally, after the baby's born, they take the epidural out. I would say about an hour or two, you start feeling your toes and your feet better, and then try to walk as soon as possible after delivery. Spinal is what you get with a C-section. The biggest thing with that is you're going to have a lot more monitors with a spinal, and you're going to have a longer period of time that you'll notice the differences. Now, spinal anesthesia is normally going to last more like 6 to 8 hours compared to an epidural, which is 1 to 2 hours. When you have the spinal, another thing is a lot of people sometimes get nausea. So, for example, we have some people who are getting C-sections. C-sections, if it's a scheduled C-section, you're probably going to come in, get some fluids, you'll have your CBC, which, remember, it's the complete blood count. Then they're probably, when it's time, they're going to move you into pre-op, which they'll probably get some leads, get some vital signs. They'll hook you up to the monitor. They'll put you into the OR suite. You'll probably see a nurse practitioner for baby. You're going to have an OB for mommy, along with an assistant OB. Usually they have 2, and you'll have 1 or 2 nurses for mommy and about 1 nurse for baby. So there's quite a few people in a delivery room for a C-section, especially because we have 2 teams. We'll have a team for mommy and a team for baby. Now, when you go in for the C-section, because I remember that Savina says she might have a C-section, so I want to make sure we're going over this. And if you have any concerns or anything, you have extra questions, you can always let me know. So when you go in for the C-section, one thing you can request is for them to put in the epidural after the spinal. To put in the Foley after the spinal, sorry. So because sometimes the Foley, which is the catheter that drains the urine, it can be a little uncomfortable. So sometimes what you can request is to get it in after you have the epidural or after you have the spinal, because in that way it kind of allows that you're not going to have that much pain because you're already kind of nerve blocked there. Now, for general anesthesia is when you're completely put under. That's when we don't have time to an epidural, we don't have time to do a spinal, and it's just emergency, and we need to get the baby out. That can be emergency situations. Usually what it's there for is if for whatever reason the baby is doing pretty bad and we need to get the baby out quickly. That's IV. We put the mommy under. It takes a little bit longer to get back in. Most hospitals will put you on something called a PCA pump after general anesthesia. You're going to be a little groggy for a little bit. A PCA pump is basically, oh, you're very welcome. What I noticed is that a lot of childbirth classes never go over C-section. So I make it a point to really go over cesarean births, because I don't want you to come out of it and be like, oh my goodness, what is to expect? So I want to make sure that I'm tailored to people, real people, not just one type of person, So we talked about progressing labor by understanding pain relief techniques. We talked about Lamaze exercises. We talked about hypnobirthing exercises, acupuncture. Now, a great thing with C-sections that you can think about too is that people always go to the pharmacological methods of pain relief after a cesarean birth, where one thing that you can do is you can do those pain relief methods that you always focus on during childbirth, and you can do that during postpartum as well, because after you have your baby, you're going to have some cramping. Now, it's going to be a little bit more intense with every baby. So usually the first baby might not be that intense, but your second baby will be more intense. And of course, with a vaginal delivery, you might have not as much pain as a cesarean birth, because a cesarean birth has the incision in addition to the vaginal delivery. Keep in mind with cesarean births too, that if you have a tubal ligation, it hurts more than if you did not have a tubal ligation. So that's just another thing to keep in mind. And use those focused breathing exercises, use all of the hypnobirthing, the flashcards. If you can write flashcards before you deliver, write some flashcards. They can be breastfeeding flashcards. They can be postpartum flashcards. They can be encouraging flashcards. They can be labor flashcards. But write some flashcards that you can have some positive affirmations that can help you postpartum, because I'm telling you, it's hard. And postpartum is my specialty. So, so this class is about 30 more minutes. We're going to focus on postpartum and newborn care. I'm going to give you guys a little 2-minute break that you guys can get some water, get some juice, go to the bathroom. Talking to a bunch of pregnant ladies here. So I know you guys probably have to go to the bathroom during that time. So we'll come back in 2 minutes. But what you can do is ask me any questions in the meantime until we go over postpartum. I've been talking a lot today, so I don't know if anybody else has chai tea, but I love chai tea, especially nice hot one. So for those who are not on your 2-minute break, what's your favorite section that we talked about so far before we go into postpartum and newborn care? Does anybody have any cool stuff that they learned so far? I hope that I'm a blessing to you guys, and I hope that you're learning some good stuff. But I love to teach these classes, and it's I know that it really helps out as well. And remember that on my YouTube channel, I do have a whole bunch of videos for you guys. So feel free to subscribe. You can always like the video, share the video, and you can always register for other classes at mommydidyouknow.com. And you can always call me. My number's on there if you want to go through my prenatal classes as well, or if you wanted help postpartum. Now we've had a little break. We're going to go over postpartum, which is my specialty. And I love postpartum just because a lot of people, they focus on childbirth and they focus on what to expect when the baby's coming, but they don't really focus on postpartum and what to expect for mommy, or even normal newborn behaviors and things like that. So after you have your baby, you might expect some shaking, some contractions, some mood swings, even period-like bleeding. Now with shaking, what I normally recommend, and yeah, it is very interesting that you cramp after delivery, because a lot of people don't realize that they'll cramp after delivery as well. So basically what's happening, especially when you're breastfeeding. So actually today when I was doing rounds in the hospital as well, I was helping a mom to breastfeed. She was like, oh my goodness, it hurts so bad. The cramps happen like as soon as I start breastfeeding. I'm like, yes, because the same hormones that are related to breastfeeding are also related to your uterus contracting. So that's oxytocin. Oxytocin is your milk letdown hormone, but it also goes to your uterus and causes it to start contracting. So that's why you will be contracting more while you are breastfeeding. Another thing is if your bladder's too full, you'll contract more. So for the contractions, try to keep your bladder empty. You can always use like a warm pad. You can use the breathing exercises that we were talking about. And with every baby, you're going to be contracting a little bit more. With C-sections, you might also, can we avoid Pitocin? So if you are having a C-section, usually they'll want Pitocin. If you are having a vaginal delivery, you can deny the Pitocin, of course, because in the end, it is your choice. The biggest reason that people give Pitocin before delivery is to kind of help the uterus contract. And after delivery, it is to help the uterus stay firm and prevent hemorrhage. Now, if you prefer not to have Pitocin, the best thing you can do is breastfeed, because what you're going to do is you're going to cause natural oxytocin to be released in your body instead of the man-made Pitocin. That is the difference between Pitocin and oxytocin. Oxytocin is man-made. Pitocin is, other way. Pitocin is man-made and oxytocin is natural. That's the one that the body is releasing. So by breastfeeding, what you're going to be doing is releasing oxytocin. It's going to go to help your milk to let down, and it's also going to go to your uterus to help it stay nice and firm and prevent bleeding. So that is the biggest thing with that. One thing is that there's some research that says that Pitocin use sometimes leads to a delayed mature milk production, or delayed lactogenesis 2 in other words. Now, to kind of negate that effect, what you want to do is skin to skin as much as possible after you deliver. That's the biggest reason. Well, one of the biggest reasons that they want to avoid, that they say that they don't like Pitocin, is because they say it interferes with breastfeeding. What you can do to kind of balance that out, especially because sometimes it is necessary to have it if, let's say, you're postpartum hemorrhage or you have a C-section, you're at risk for bleeding. What you can do is do skin to skin as much as you can, because by being skin to skin with the baby within that first hour of life, especially, and as much as possible. So it doesn't even need to be just that first hour of life. It can be as much as possible during that transition period. That's going to help to release that natural oxytocin. Try to breastfeed within that first hour of life, and try to breastfeed frequently, about every 2 to 3 hours or so. But the more frequently that you breastfeed, the more that mature milk will come in. And same thing with the skin to skin as well, because the skin to skin is going to cause that natural process of creating milk. Now, you start creating milk around 14 weeks. So technically everybody that's mentioned something, because I was looking at how many weeks you are, everybody pretty much so far, you are all creating colostrum already, because it happens about 14 to 16 weeks postpartum, during pregnancy. Now, what ends up happening is your placenta releases these inhibiting hormones that prevent the release of your breast milk. So let's say you have your colostrum and all of your breasts are already starting the process of creating milk. Now it is being delayed simply because your placenta's in. Now, once your placenta leaves your body, it starts the whole cascade of starting your mature milk supply. So as that happens, you're going to notice that it's going to come out in little drops first, but your stomach, the baby's stomach, is literally this small. Like, I don't know if you can see from here, but it's the size of a cherry. Average babies drink about 7 to 10 cc's per feeding for the first 24 hours or so. So it's very, very small. Normally it's about 7 to 10 cc's per feeding the first day. Second day, it's about 20 to 30 cc's, but every baby's different. So they don't need to eat that much. So what to expect? We were talking about shaking. I just love talking about breastfeeding. So I want to do, by the way, I do have another class Wednesday, 3:00, breastfeeding. And I always think it's 3:00. Where is it? Oh, it's Wednesday at 2:00 is my breastfeeding class. So, and it's also on my website as well. If you look for on mommydidyouknow.com, you'll be able to see my other classes too. And I have a breastfeeding class as well. That's free, live also, that you can ask questions. And this is for pregnant women and women who are breastfeeding. So a lot of the times you'll be able to hear what different people go through, that you can hopefully avoid it. So for shaking after delivery, you can try skin to skin. You can try warm blankets, contractions. We were talking about the focused breathing, guided imagery. We were talking about keeping your bladder empty. Mood swings, skin to skin helps with mood swings. It helps regulate your hormones. Breastfeeding helps to regulate your, and I'm sorry that your internet has you behind, but I'm glad that you are enjoying the class. So anyways, another thing is rooming in also helps, because what happens is when you room in, it increases your breastfeeding rates. And when breastfeeding is going well, it also will increase your mood. And especially the skin to skin will help with your mood swings. Period-like bleeding. Period-like bleeding is going to be normal even with a C-section, by the way. So keep that in mind. So even with a C-section, you might still have lochia. It lasts anywhere from a few days to a few weeks. Now, everyone always asks me how much is too much. If it's the size of your fist or bigger, that's too much. If you change your pads in 1 hour, it's saturated again, that's too much. So that is too much bleeding. You might even notice that, let's say it'll come out, especially that first day, it'll be a lot, then it'll be a little less and less and less and less and less until finally it stops. while you are breastfeeding, by the way, usually your period does not come back for some time. And that's also when you are a little less likely to get pregnant. So that's how they have the lactational amenorrhea method, which is where when you are exclusively breastfeeding, at least every 2 to 3 hours, even overnight, without pauses, without any supplementation, until your period comes back, up until like on average about 6 months, you are much less likely to get pregnant again. So that is called the lactational amenorrhea method. But in order for that method to work, that means that you have to be exclusively breastfeeding every 2 to 3 hours without too much of a gap at night. And you have to be within 6 months postpartum. So I hope that gave you some good tips as well. Complications postpartum, hemorrhage. Now, when I see hemorrhage, it literally looks like jelly. So when it comes out, you'll feel those gushes. You might even feel gushes the first day or so. That's normal. We usually do a little bit of fundal massage. Even if you are having a home birth or you're having a birthing center, you might even still have a little bit of fundal massage. That's just to keep that uterus nice and firm. Hemorrhage, if you do have hemorrhage, we'll try. That's one thing where they'll probably put the Pitocin if you're in a hospital setting. If you're at home birth, they'll do a lot of vigorous fundal massage. Depending on how bad it is, they might end up having to admit you to the hospital. And hopefully they'll try to empty the bladder as well. We'll try to give you a Foley as well, empty the bladder. And they also have medications we can give you, like Methergin, Hemabate. It's just some of them do have some side effects. Like Hemabate sometimes makes you have diarrhea. Methergin sometimes increases your blood pressure. So there's certain recommendations for that. High blood pressure is also a complication postpartum. So even though you might not have dealt with high blood pressure during pregnancy, you might have it postpartum. So sometimes it happens right out of nowhere. So I have this one friend, for example, where she did not deal with high blood pressure during pregnancy, but then, or even with her first 2 kids, she just had her 3rd kid, 1 week postpartum. She started having she started having a lot of headaches, and it ended up being blurred vision. Goes to the hospital and ended up being admitted with magnesium and high blood pressure. So make sure that you are aware of the signs of high blood pressure, headaches, blurred vision, sometimes even nausea, delayed reaction times for things, delayed nerves. Also, what you'll see too is seizures when it becomes pretty late in the game with high blood pressure. Sepsis is infection. You might also, another complication that sometimes happens are UTIs. So UTIs are pretty common after delivery. So if you do see a UTI, especially if you had a Foley, try to, one thing that I recommend, because some people hold their bladder after delivery because they're afraid of the burning. So one thing that I do as postpartum nurse is I'll say, take that peri bottle and spray the perineal area at the same time that you're peeing. And that will neutralize the acidity of your urine and will hopefully decrease the amount of pain that you're having, especially with that first pee. So that will hope that you're not, holding your bladder too much, and it's making sure that your perineal is nice and clean, your perineal area. No douchings or tampons, by the way, for 6 weeks. Nothing in the vaginal area for 6 weeks. Depression, difference between depression and baby blues is that baby blues are short-lived. Depression is a lot longer-lived. And also depression gets in the way of daily life. Baby blues is more like you just might feel blue about something, especially sometimes, let's say something doesn't go according to your plans. Let's say you had in mind for a vaginal delivery and ended up being a C-section. You had in mind to breastfeed and you ended up having to supplement, or the delivery didn't go in as you planned. All those can lead to baby blues. Now, we have a case study here. So I have a friend who ended up with a 4th-degree tear, and she wanted to know what are some ways that I could recover better after a 4th-degree tear, or even a tear in general. So remember, I was talking about how episiotomies, they usually repair quicker than natural lacerations, but they hurt more. So one thing that you can do is you can try to use a peri bottle as you're peeing. We were mentioning that before, having good perineal hygiene. One good thing, and this is a really good tip, especially for my vaginal delivery. So I write this down actually, because this is a really good tip. If you end up with a painful tear and you want to breastfeed, try to learn the laid back position, the side lying position, because the side lying position will keep the pressure off of the perineum. So even though you're having a really bad perineal tear or a vaginal tear, you can still be able to breastfeed on the side lying position. Because some people say, oh, I can't breastfeed because I can't sit up because it hurts so bad. If you lie on your side, you'll still be able to breastfeed that way. Some other things to help with the tear, they have these little donuts that you can sit on and try even putting a pillow underneath. They also have SIDS baths. We do have them in a lot of hospitals, SIDS bath. They're basically a fancy bowl that you stick your bottom into. So those work as well. You can fill it with some warm water, and it's like a spa for your bum. So those work pretty well as well. So we talked about postpartum care, labor and delivery. Do I have any questions about anything before we move on to the next section, which is newborn care and breastfeeding? We're going to spend about 20 minutes on newborn care and breastfeeding. So just as a review, we talked about childbirth, we talked about pregnancy, pain relief methods. We talked about non-pharmacological, pharmacological. I'm like, man, I must be such a great teacher because no one has questions. So if you have questions about anything, you can let me know. Or even if one thing's normal, something's not normal. Now, normal newborn behaviors. And I go over for those of you who end up getting my my prenatal package. You can always call me. My number's on the live chat as well. And on mommydidyouknow.com, you can always set up consultations. All my information's there also. A lot of insurance plans cover it, by the way. So I just wanted to throw that in there. They cover prenatal visits and lactation visits. In about 3 months, I'm also going to be in network for a few insurance plans. So I'm so excited about that as well. So behaviors. So normally after babies are born, they're going to have about 1 to 4 hours of an active phase. That's when it's really important to try to breastfeed as soon as you can. And it's really interesting because now as a lactation nurse, I've noticed some things. I've started kind of steering away from postpartum, because for the past 9 years, I've been postpartum, labor and delivery, but mostly postpartum, but also labor and delivery, antepartum, NICU, nursery, all of that. Now for the past about 6 months, I've taken over lactation. And I've noticed some really amazing things that I never noticed before as postpartum nurse. One of the biggest things is that I can tell a huge difference in the moms who end up breastfeeding in that first hour compared to the moms who don't, in terms of their milk supply and how quick that mature milk comes in. So, I mean, it's amazing. I'll have moms, and I can even tell which breast that she put on the baby first, which is crazy because let's say I see the mom, let's say a few hours later, she goes postpartum, and I'll hand express both sides. I'm like, you latched the baby on this side first, didn't you? She goes, yeah, I did. How'd you know? I'm like, because this side's pouring out. So one thing that you can do, especially that first breastfeeding session, is try to put the baby skin to skin with you, latch the baby on one side, skin to skin, change the diaper, make sure it's nice and clean. Put the baby skin to skin with you again, give the baby a little break. And then instead of swaddling the baby up and putting them in the crib, instead put the baby to the other side. You're going to notice a huge difference in your milk supply. I cannot strive this enough to my pregnant patients, because they come in, they have the baby, and then, they're tired after you have the baby. And I understand that. But then what ends up happening is, a few hours down the road, they're like, I don't have much milk. So try to hand express, or at least put the baby to the breast. If the baby's not latching on for that first session, take your hand express. The way that I hand express, I'm going to move this down a little bit. So I lift up. This is one of the best techniques you can learn. You can even do it prenatally. Get some little syringes, like 1 cc syringes. You can freeze those syringes and then bring them with you to the hospital so that you can supplement with your own syringes if need be. And you can start it during pregnancy to see how your body responds to hand compression. So what I'll do is I'll lift up like an underwire bra, make a U. Then what I'll do is, this is around the areola. This is the nipple. Dark part is the areola. I put my fingers around the edges of the areola. You push back and then together. Push back and together. Back together. And almost like a massage. And then what you'll notice with that is that you're going to notice a lot more milk being expressed that way than if you pinch the nipple. Because what I notice is sometimes people try to pinch the nipple, and then what ends up happening is nothing comes out. So areola, back together, and then that will help with your hand expression. Now, behavior changes. 1 to 4 hours, they're very active. Then after that, they hit about 12 to 24 hours of hibernation. That's when you got to wake the baby up for feeds. Then they hit about 24 to 30. After that 24-hour mark, they wake up. And then about the next day or so, it's the fiesta time. The party never stops. And then they're cluster feeding. What you want to do is realize that that's normal newborn behavior, and that the first 24 hours, you want to hand express as much as possible. If your baby is not latching on, hand expression is sufficient according to the Academy of Pediatrics for babies that are low risk. Now, if they are high risk for hypoglycemia or low birth weight or premature, then they might need something a little extra. But if they don't have those risk factors, you'll be okay with hand expression and offering it to the baby the first 24 hours. Now, after 24 hours, they wake up and they make it for last time by cluster feeding. That's normal biology's way of saying, let's get that mature milk. So that's one thing you can think about. Is making sure that you are offering the breast frequently and effectively. And we'll go over breastfeeding in a little bit as well. So normal newborn, they're going to have some vernix, is that kind of waxy substance around the skin. They might have a little bit of a newborn rash as well. That goes away on its own. Sometimes you even can add some breast milk to the baby's bath water, and that can help with eczema. It even helps with diaper rashes. If you add your breast milk to diaper rash creams, it helps with diaper rashes. And you can even add it to, if you have, like, sometimes babies get an infection of the eye or crusties around the eye, and breast milk can help with that as well. So there's so many different great things with breast milk. Now, newborn rash is normal. Now, noisy, rapid breathing. I say rapid, but it's really faster than you would think. So babies, normal breathing rate is about 30 to 60 times per minute. So that's a lot quicker, a lot faster than adults. Adults is normally about even 14 to 20 times per minute, even 16 to 20 times per minute. We're talking a baby doing 30 to even 60 times. And then sometimes at birth, it's even more than that, just because they're so excited. So that's normal. Another thing is it's very irregular. It's not like adults where their wavelength is like this. It's very boom, boom, stop, boom, boom, stop. So you'll notice that as well. Soft spots, anterior fontanelle here, posterior fontanelle here. That is going to be in the babies, especially while they are being delivered. They have to be able to be malleable as they are coming down the birth canal. So that's where those cartilage spaces are formed. Now, the soft spots closes about 1.5 years anterior and 3 to 6 months posterior. So one interesting thing is that they do sink in when baby is dehydrated. So that's where it goes under the red flag here, sunken fontanelles, because if your fontanelle is sunken too much, it can be a sign that your baby's dehydrated. We also have red flags, retractions. That's different than just rapid breathing. Retractions is when you're using your accessory muscles to breathe. So you'll actually be seeing the ribs go in and out. Lethargy as well. You might see your baby very, very tired. Fever is another one. Tachypnea. Tachypnea is fast breathing, so over 60 times per minute. And then GBS infection can cause fast breathing and respiratory distress. So if you notice, especially if you see nasal flaring, for example, like nasal flaring is when all of a sudden the nose kind of goes like that out, that's nasal flaring. Or if you start seeing tachypnea, the baby's breathing fast, you see retractions, labored breathing, all of those different things are all signs of respiratory distress. Now we're going into feeds. Now I love going into the breastfeeding. Of course, that's my favorite section. So for breastfeeding, what you want to do is, like I mentioned, put the baby to the breast as soon as you can. And I have this lovely little baby. Nathan, my second baby, he called her Victoria. So I'm like, all right, I guess her name is Victoria. But so this baby right here is going to pretend like she's a newborn, but of course your newborn is going to be a lot smaller than this. Now for breastfeeding, first you want to make sure your baby is nice skin to skin with you. Okay. So baby comes out, first thing you want to do, let's do some skin to skin. They might do like ways and stuff like that, depending on the protocol, but you can always request to delay separation for, the first few hours or something like that. But although the weighing is in a scale that's right at your bedside, so it's not like you're being separated, but you can always say, let's do skin to skin for 1 hour before doing extra procedures. So that is within your right as a patient. Now we do skin to skin time. Now this is a doll, so she's not skin to skin, with just a little diaper there. What the diaper does is prevents you from getting pee and poop all over you. Now, when you hold a baby, what I do is I have nice support over the shoulder blades here. And then I also support the baby here. Now that's how I'm holding my baby. Now what I'll do, there's a few methods. One is you can lay back and do the baby led, where you just kind of lay flat on the back and then allow the baby to find its way to the breast. And usually they'll find its way to the breast within 1 hour. Another way is a mommy led position, where you're sitting up, baby is skin to skin with you. You hold the baby like this. And then instead of cradling the baby like this, which is kind of hard with a newborn, what I'm going to do is actually take one hand, put it across the baby so that there's nice and well supported. And you see how I'm supporting the feet, because a lot of babies, they don't like their feet dangling. When their feet are dangling, they're going to be like, give me something to hold on to. So I'm going to make sure they're nice and well supported here. I'm going to make sure that my forearm is supporting the back. And I'm going to make sure that I have my hand around over here, the shoulder blades, with my fingers around here for support. Okay. You could even practice that with like a teddy bear or something before, or even a baby. Now what I'm going to do, as you can see, baby, I want to put about a half an inch away from my breast. A lot of moms, they go like this. They put the baby right here without allowing the baby to wake up. I wait for the baby to open first. I'm going to tip my nipple up. So actually what I'm going to do is either put my thumb this way or even tip it up this way, still leaving enough space for the baby to latch on. Then what I'm going to do is I'm going to have, when the baby opens, I'm going to bring the baby up and over. So as baby opens, up and over. Technically, the chin is the first thing that touches the breast. Chin, up and over. So that's one thing, is a lot of people, they'll just kind of go like this, or I see this a lot for the first feeding. But then what ends up happening is the feet are dangling, they freak out, and then you don't get a very good latch this way, because it's going to be very bullseye. This way, you're going to get a much, much better latch for that first time. But remember, hands on both sides. It's kind of like, if you think about it, it's kind of like a cheeseburger. If you have like a double cheeseburger, like not from McDonald's, but like a real cheeseburger place, you're going to go up and over. So it's the same thing with babies. Now, with breastfeeding, how do you know that you're latching well? One is the positioning. So remember, when we had the baby position, the head, shoulders, and hips were all in alignment. So it wasn't misaligned. So if you like take your head and you kind of turn it to the side, what you're going to notice is your esophagus closes up and it's harder for you to swallow. Same thing. Another thing is your feet are going to be flexed a little bit as the baby is latched on. That's going to open the mouth a little bit more. And then you're also going to notice that there's going to be swallows. If you don't see swallows, that will be one kind of sign like, hey, I'm, for whatever reason, the baby is not effectively latching on. You want to see about 1 to 2 sucks and then a nice little swallow. Although sometimes it might take longer, per swallow, but you'll see some swallows. So we'll have nice alignment. We'll have to make sure the baby's latched on well over the nipple and the areola, nice flanged out lips that are about 120-degree angle. So if they're too shallow, you're going to notice pinching. You might notice tugging, but not pinching. If it's pinching, that means it's too shallow. Now, let's say for whatever reason, baby is not latching on, or baby needs expressed milk, baby needs supplementation. Let's try expressed milk first. So we're going to try direct breastfeeding. That's not working for whatever reason. Let's try some expressed milk. Let's try pumping or hand expression. Hand expression is going to work better than pumping for the first few days, especially because the colostrum is really thick. You'll put a pump on, nothing's going to come out, and that's normal. So we're going to try to hand express as much as we can. We talked about hand expressing a little bit earlier. We're going to try to give the expressed milk, not from a bottle first. So a lot of people go straight from the bottle. What you can do is always give through like a syringe or through a medicine cup. I like cup feedings, and cup feedings are really simple. So all we're doing for cup feedings is we have your baby, we have your medicine cup. You can get these from Amazon too, which is really cool. And all I'm doing is I'm making sure they're nice and well and supported. We have our medicine cup. I'm going to tilt the baby's head just a little bit, and then I'm going to put the milk, not pouring it in, but I'm going to put it right at the tip. So a lot of people didn't even realize that you can feed a baby from a cup. I would say if it's anything up until like 30, you can actually feed from a cup. Sometimes I'll even do little drops from there. And then what it is it's kind of like a puppy lapping the milk out of the cup. So you're not pouring it in. All you're really doing is putting the milk right here. And then the baby will open up their mouth. And then with that open mouth and then that little bit of taste of milk, sometimes they're like, oh, I really like that. Let me get some more. So you can always use cup feeding, syringe feeding as well. Although I prefer cup feeding over syringe feeding just because it encourages a wider mouth and it encourages more tongue movement than a syringe. Syringe, you're kind of just like putting them to the side. So I like cup feeding because it encourages them to bring the tongue out, especially for like tongue ties. That works really well. If that still doesn't work, we also have supplemental nursing systems, which you can always buy before you deliver. The one that I like is the Medela one. They have a Medela starter nursing system. That one is one in which it's like a feeding tube that comes out right at your nipple. So then as the baby's nursing, if you need to have supplementation for whatever reason, you can have it straight through the starter system. So the baby's nursing and having the supplementation without having to give the extra bottle for whatever reason. So those are all lactation aids that you can use. And then you can always call me too if you have questions. I'd be more than happy to answer any questions that you have. And then, so I loved this section with you guys. I feel like we really learned a lot. Did anybody have any extra questions, or did anybody have, what was everyone's favorite section, or what was maybe something that you learned that you did not know before? So we had a lot of really cool techniques. We have a lot of cool methods. What was everyone's favorite kind of take home from this class? And I like doing this on YouTube as well, YouTube Live, just because it also allows you to be able to watch the video later. So especially, we have a few people who are kind of earlier in their pregnancy. So at least you can always look through this later, and feel free to go to as many classes as you want. So especially because each class will always be a little bit different depending on who's in the class. So feel free to visit to as many as you want. Now for you guys, you always can call me anytime. You can always check the website as well, mommydidyouknow.com. And then you have your programs, you have a whole bunch of resources for you as well. And I just wanted to say that it was a pleasure to see you guys. And I hope that it was good for you. You always can thumbs up. You always can subscribe as well. Feel free to join me for my next class also. I know that we go over a lot of stuff. We have our breastfeeding one will be on Wednesday too. So I sincerely hope that you guys have a good rest of the day. And you always can message me or send me a text message. Also, if you do want this PowerPoint, you can always send me a text message and I can give it to you as well. All right. So do I have any other questions before we end? Remember, you can always contact me if you wanted the prenatal package also, especially for those that are close by, but you also can have it far away. We go over all of this stuff, but more in detail, more focused on what you guys need. And then it also comes with visits that you can have either virtually or in home as well. So I'm glad that everybody loved it. Thank you so much. So have a good rest of the day. I'm going to be ending the video now. Thank you so much. All right. Bye-bye.